Hello, everyone. My name is Paula Harvey with the Cy-Fair Chamber of Commerce, and Angela Irvin is here joining us today. We have Julie Peterson, the Director of Business Development for Houston Methodist Willowbrook Hospital with us. We're so excited to see her. They've been longtime members, and we know you're busy, Julie. So what we wanted to ask you, and just a few questions to update us on what's going on. We know there's a lot going on with the hospital, but as a business development position or even within the hospital, tell us what some of your challenges have been.
Oh, absolutely. Thanks so much for having me. And it's a pleasure to be here and to see everyone and to see everyone at the chamber. You know, hospitals obviously have had really new and unique challenges with COVID. I mean, and I would say anyone that's in healthcare right now in the chamber or in our community have felt many of those challenges. And I think the one thing that was great for us from one perspective is that we're in the business of caring for patients. So when we were talking about this time of a pandemic and a COVID, you know, that mission and focus stays clear. We're going to keep caring for patients. We're going to make sure they're getting good care and in a manner that's safe for the patient and the physician and the staff, even the visitors. And if you're coming in to see someone, you know, how do we keep everyone safe that's walking in the doors? And like many businesses, you know, we certainly had challenges that a lot of people have about making sure their employees feel safe, being informed. But I think from a hospital that stayed in operations during this and has a whole new world with this virus, it was all about making decisions and coming up with solutions fast. Like everyone, information was hitting us left and right. New information, not only clinically, but also safety-wise. And how do we filter that information and come up with plans and processes? You want to react to that information, but you have to be proactive too. And so I think we did a few things to overcome that. So how we addressed that challenge was coming up, first of all, with a clear structure. We immediately put in place a 24/7 incident command center where we had our leadership team. I was involved in that incident command center, a cross-representation of our experts who were available. We were on calls a couple of times a day, even weekends, filtering decisions and putting those back out on how we were going to manage different situations. And we relied on our experts. We have an amazing team of people at the hospital, and we're also part of a bigger system. And you know, you pull in all those experts, whether that's administrative experts or clinical, biomedical engineers and educators, and that really helped us on any issue that we had to address, pulling in that expertise. So for example, our central supply director and many of our other key logistics folks had a logistics team. Do we have enough PPE? Our clinical team looking, do we have enough beds? We made a decision as a system to cohort our COVID positive patients at one location in the system. And that helped us organize and feel that we were cohorting our patients to keep all of our patients safe. So a lot of pulling in that expertise. From my perspective, a lot of my role is physician communication. So as you can imagine, we have over 2,000 employees and over 1,000 physicians on our medical staff. So how are we getting that information out quickly, succinctly? Because when new information is coming every day, people want to know, you know, what's going on, what's the new process. So like everyone, we embraced a new virtual world and did a lot of town halls and WebEx and phone calls, and that was very, very effective. So people always knew what's the visitor policy, has it changed, what personal equipment will I have and not have, and we were always structured and set up to address all of those questions so that people felt confident coming into the hospital and doing their job. But I think, I know I'm telling lots of solutions, but I think one of the greatest solutions is what I have to say is innovation. Houston Methodist has a whole center for innovation, and we do a lot of great work around innovation. But during this time, I think that went to a whole nother level. We had a central location where people could submit an idea, and any idea is a good idea, right? And that could be about how we're going to care for our patients to any type of solution during this pandemic. So I'll share a couple of those. From a system perspective, we had some really amazing, even clinical innovations. We had a team that developed a plexiglass isolation pod that they immediately put into test and put into practice that could help protect the patient getting care and the physician and team at the right time. locally here at Willowbrook, we are the first in our system to create a extended emergency department to our main emergency room. So if you would have been on our campus, you would have seen a big tent out there, and we began triaging patients out there with the right equipment, keeping people distance. So we knew what we were dealing with before we moved people actually into the facility. So innovation was just really at a high, and I think that helped us really get through this challenging time.
So Julie, is there one aha moment you had through all this? It sounds like there's many, but can you pick up one that just amazed you that came from throughout all this collaboration?
I think the biggest aha was just, gosh, that's a really tough one, but it's just collaboration. It's just people stepping up to the plate, which I know it's not one big wow thing like a new development, but it's just that you have so many players in healthcare. You have, like I said, your physicians coming in, your staff. You have people who are used to being on the front lines, but you have others who, are or may not be working so much with such a delicate patient population, I guess is a good way to put it. So, but everyone just stepped up to the plate. We're not in a position, a lot of us, to work from home in healthcare. And people got educated. They learned how to protect. We learned how to make sure we had a safe environment, and we went to work. And I think that that's just overall just a great overview of how we handled the situation. And it's just humbling to look at it and say there wasn't just one department that was considered a healthcare hero. I mean, I think everyone on our campus would be a healthcare hero.
Agreed.
Yeah.
Wow. Yeah, it's like it brings it all into the picture of how many employees and how much you have to streamline and everything you've done to make that work, the system. I loved hearing that you took ideas and collaborated, and that's pretty interesting to hear. I love that. If you had words of encouragement for business owners or business people, what would you say? How would you help them in this tough time?
Oh gosh. So words of encouragement would be from a Sci-Fair community standpoint. We have a fabulous community. We all know that. We're here for each other. Just kind of like if you think we were so overwhelmed by our community and the chamber reaching out to us and helping us during this time with food donations or getting us in touch with masks and equipment and offering hand sanitizer, whatever they thought the hospital would need. So we felt like we also were responding and helping our community. So I would say be encouraged. Your area businesses, your partners, your community, they're there for you. Same with the hospital. We're trying to order food out when we can and bring it in safely for our team and use our local businesses. I think what I would also encourage people is that some people are fearful. They're fearful of, being in the community, and particularly some are fearful coming into a hospital or a clinic. And I would say that Houston Methodist and all of our healthcare providers in the area are working really hard to make it a safe environment. We've implemented so many amazing things to make it safe for patients to come in. So I would encourage people, because we want people to get the healthcare that they need and not put it off, which could, result in a scary situation. So I would encourage people that it's safe to get your healthcare. It's safe to come in. People are going to see many different processes, which I think are interesting. Some that we may never go back to. We implemented virtual registration. I mean, things that are really cool, where people are registering online for a procedure or a test. They're texting when they arrive, and someone's meeting them and taking them straight to that procedure or testing area. So they're minimizing wait. It's things we think, why didn't we do this before? And we'll probably keep doing. And so I think people need to be encouraged about what type of environment that they'll walk into. But one thing that I think is really encouraging, and a lot of people may not know this, but Houston Methodist as a system started over 100 years ago. And our very first hospital started as a result of the Spanish flu pandemic. That is actually a physician who said, we need something to address this pandemic. And thus Houston Methodist Hospital started. And we're here 100 years later. And so like we've been saying at Houston Methodist is we made it through that pandemic, and we're going to make it through this one. And I really feel like as a community, we'll rally together and get through this. And I think everyone should feel positive that we're going to be here 100 years later. So.
Wow, that's a great piece of information, Angela. We're going to have to share that.
I know. That's amazing, Julie. That's just
We
amazing.
love our partnership with you and for so many years, and appreciate all of those frontline first responder, everybody in your system. You have dynamic teams, and so glad we could do this today. So thank you. We look forward to seeing you in person sometime soon.
Thank you,
Absolutely.
Julie.
Y'all, thanks so much for asking me, and it is a joy to visit with you, and can't wait to see you in person also.
We look forward to it as well. Thank you, Julie, also for serving on our board of directors. We appreciate whatever you do very much.
Oh, it's my pleasure. My pleasure. Thanks for all y'all do, and I hope y'all have a good day.
Thank you.
You too. Thank you. Have a great day.